How do you see tinnitus treatment evolving over the next 2 decades?
I think that it is going to go multidisciplinary. It is going to disentangle. I think that hearing will be treated with hearing aids and hearing instruments. I think that bimodal will become, a mainstay in future standard of care. I think that CBT apps are very interesting because they get around the scaling problem. As I said, there aren't enough psychologists in the world to deal.
Especially specific to this condition.
There are 50 million Americans with tinnitus. There aren't enough therapists in America to deal with that.
Sure.
And as I said, they're competing with all these other conditions, these other, depression, anxiety, all these other things which are growing, so there's a scalability issue with CBT, but I do think these CBT apps get around that. So I think that there will be that disentanglement will happen, that, when a patient comes to a provider like yourself, they'll say, I have these issues, and you'll say, well, we're going to treat your tinnitus with bimodal. We're going to, treat your hearing with hearing aids, and then we're going to, treat your psychological distress or manage that with CBT, with an app. So I predict it will be a kind of a multidisciplinary approach in the future, and it won't be just one solution looking to dominate or compete. That's my own.
There's a lot of hope. There's a lot of hope there.
Absolutely.
Which is what we need.
Yeah, absolutely. And I think though, if we take that approach, and realize it's a journey, right? I mean, I always say that tinnitus is like the canary in the mine. It's the leading biomarker that tells you that your lifelong hearing journey has started. So like many of your other health journeys, the relationship that you form with your audiologist, that's going to be a lifelong relationship, right? And you are going to have to come back, like eye exams, you're going to have to come back every year or whatever for your check-in, and see how are your needs evolving, and those needs will have to be addressed, they'll have to be managed, and it'll have to be done through a kind of an expanded management portfolio, and that's essentially that's going to be it.
Multiple tools in the toolbox.
Yeah, exactly. Yeah. Every other medical discipline is like that.
Exactly.
So audiology will be like that too.
No different. Absolutely.